Greetings. I am Adriana Miranda, a fifth-year medical student from Faculty of Medicine, University of Indonesia. Thank you for Beyond Science Initiative and International Remote Conference for the opportunity to present my review entitled Perceptions and Perceived Challenges of Telemedicine Adoption in Developed and Developing Countries, Lessons from COVID-19 Pandemic. As an introduction, telemedicine offers significant benefits to healthcare services, including increased accessibility and reduced costs. This is especially important for rural areas, which has little to no access to healthcare services. Acknowledging the benefits, the WHO member states have adopted a resolution in 2005 to adopt telemedicine globally. In 2019, the WHO published the global strategy on digital health, which aims to ensure equitable, affordable, and universal access to telemedicine benefits. However, challenges for global adoption of telemedicine persist. One of the major challenges is the disparities in telecommunication infrastructure and overall health system between countries, especially developed and developing countries. On the other hand, the travel restrictions due to COVID-19 pandemic has led to accelerated adoption of telemedicine because with the travel restrictions, patients now have limited access to go to the hospital. Thus, they are now widely using telemedicine. So this happens in both developed and developing countries. The aim of this review is to analyze patients' and providers' perceptions towards telemedicine adoption during the pandemic and to compare the perceived challenges of telemedicine adoption between developed and developing countries. So this is the methods of the review. I conducted a literature search in Cochrane and PubMed in December 2020, and I also include additional studies that are relevant with the topic. The inclusion criteria of the studies are the studies that reported perceptions of patients and healthcare providers towards telemedicine adoptions during COVID-19 pandemic. Hence, the article should be published in 2020. The study design included in this review is observational, qualitative, and mixed method studies. And the articles should be written in English or Indonesian. As for the exclusion criteria, I did not include review art and perspective articles and also studies that does not have the full text available. So from the literature search, I included 30 studies from 11 countries, 5 developing countries, India, Indonesia, Tanzania, Lebanon, and Chile, and 6 developed countries, Canada, UK, US, Spain, Germany, and Australia. And in these 30 studies, telemedicine is conducted for management of chronic diseases such as diabetes, cancer, to autism, and also for outpatient visits. And the overall patients and providers' perceptions of telemedicine are generally positive. Even in 3 of the included studies, that also researches about the willingness of the patients and healthcare providers to continue teleconsultation after pandemic. The perceptions is positive. This is shown that by this number that 65 to 96% of patients and healthcare providers are willing to continue teleconsultation after the pandemic. As for the advantages and challenges of telemedicine, the patients and healthcare providers have identified many significant advantages. The first being increased accessibility, especially for patients in rural areas, as well as shorter waiting time, scheduling flexibility, and for healthcare workers, there's value in observing patients in home environment because it enables them to see patients from different perspectives. However, with these advantages comes several challenges that need to be addressed. One of the challenge being technology gap between younger and older generation, with the older generation being not technologically adapt and thus needing more training to conduct telemedicine. And there's also need to ensure ease of use of telemedicine platforms. And in some countries and places, there's lack of sufficient technology infrastructure and equipment, including the um, suitable phone for telemedicine and telemedicine equipments, etc. And there's also data protection concerns. Another advantageous is the decreased monetary burden for travel and for consultation. However, this can be hindered by the unclear insurance reimbursement scheme, especially in developing countries, but also in developed countries, which I will explain later. And um, there's also limited care quality because um, patients may miss or misinterpret the symptoms, and um, the telemedicine session is not able to accommodate multidisciplinary advices. Um, and this is especially needed for chronic diseases such as cancer. Comparing developed and developing countries, the technological barrier is more significant in developing countries. As an example, in 2019, only 31.1% of Indonesians and 25% of Indians own smartphones, compared to over 75% ownership rate in the US and the UK. The UK is even the largest smartphone users worldwide, with 82% of its population using a smartphone. And another barrier in developing countries is the limited national policies regarding telemedicine, including about the unclear reimbursement scheme. So in developed countries, the unclear reimbursement scheme happen especially in patients using private insurances. But in developing countries, this barrier happen for patients that uses the government-owned insurances. So this signify that the developing countries still has very limited policies about telemedicine adoption. So this is also shown in the WHO Global Telehealth Report in 2015, which reports about the member states' adoption of telehealth in terms of policies, strategies, and funding. So as you can see here, in developed countries, uh, even if they don't have um, policy specific for telehealth, they have the policy included in the overall national e-health strategy. And um, while in developing countries, mostly don't have a specific policy for telehealth or e-health. And as for the funding, most countries, both developed and developing countries included in this study, have um, public source of funding. However, as you can see here, Lebanon still does not have any specific funding for e-health. And this report does not have data from Germany, India, Indonesia, and Lebanon. As for the conclusion, the impact of the pandemic of telemedicine adoption is the widespread usage, which has led to the overall positive perception of telemedicine, thus offering opportunity for acceleration for global telemedicine adoption. However, and this also lessened the telemedicine adoption gap between developed and developing countries, because as you can see there in the previous slides, um, while several challenges still happen uh, here, as you can see in Chile and Lebanon in 2015, there still isn't any policy specific for telehealth or e-health, but now um, the the country has used telemedicine and they have um, positive perceptions about it. So the pandemic can lessen the telemedicine adoption gap between developed and developing countries. And to further accelerate this telemedicine adoption, the country should follow the WHO Global Strategy on Digital Health, especially in developing infrastructure, policies, and national budgeting for telemedicine. So that strategy should be prioritized because, as we know, telemedicine has many benefits. And by prioritizing this development, um, the member states can um, further improve the quality of healthcare services in their respective countries. This is my references. Thank you.